Well, July is Sun Safety Awareness Month, and the Nebraska Cancer Coalition is working to increase awareness of sun safety and skin cancer. We are joined today by Dr. Casey Bowen, a board certified dermatologist at Dermatology Associates who specializes in skin cancer and is passionate about rural communities. Skin cancer is the most common type of cancer, and there are certain risk factors that put people at a higher risk for skin cancer. And Dr. Bowen, what are some of those factors that put people at a higher risk for skin cancer?
Being fair-skinned, blonde or red hair is certainly an increased risk. Even having a redheaded relative puts you at an increased lifetime risk of melanoma. And then outdoor jobs or outdoor hobbies with a lot of sun exposure and inadequate sun protection in the way of sunscreen or protective clothing.
If people have some of those higher risk factors, should they approach going outside maybe differently than someone who doesn't have those high risk factors?
Absolutely. They should be more regular with the use of sunscreen and reapplication of sunscreen, and ideally a high SPF 50 or higher.
And what are some of the common misconceptions that people might have about skin cancer?
About skin cancer, sometimes people who tan easily don't worry that they're at risk, but many people of darker skin types, including Bob Marley, died of melanoma, and so the ability to tan doesn't protect one from skin cancer; it just makes it harder to get a sunburn. But there are cumulative effects of sun even in people who tan easily, and they should also use sun protection.
You mentioned sunburns. When should somebody start getting concerned if they have sunburns over their body?
Five or more peeling burns in your lifetime increases your risk for melanoma. So, from a long-term standpoint, having growing up having had many sunburns, or a family member with skin cancer would be a reason to come in for like an annual skin surveillance, a skin cancer check.
You mentioned getting checked. Getting checked is something everybody should do. And how often should they do it? And how should they approach going and getting checked?
So, especially in rural Nebraska, your best access is probably with your primary care team. And if they notice anything of concern, they can elevate that and get you referred to to a specialist. I also recommend people just keep an eye on their own moles. Having more than 50 moles is an increased risk for melanoma, and that can be a little daunting. But if you practice looking at your skin, it's easy to pick out something new or changing.
You mentioned the amount of moles someone should look for. What other characteristics should people look for, maybe in those moles that maybe might be different and maybe might be a little bit of trouble?
Yeah, so we talk about the ABCDEs of melanoma. So a mole that is asymmetric, one side doesn't look the same as the other, has irregular borders. So instead of a smooth contour, it's got jagged edges. Color change, or just a different color than the rest of your moles. Diameter bigger than a pencil eraser, and then E is for evolution or change. A mole that's been stable for a long time and then starts to change.
What is kind of what you look for when you're doing a skin check? What do doctors look for in those skin checks when people go in to do those?
So kind of the easiest thing to do is to look for the ugly duckling, a mole that doesn't look like the other moles. When you come in to see a dermatologist, we use a magnified polarized light called a dermoscope. So we're actually able to see the way the pigment is arranged. So sometimes moles that look really funny clinically are totally fine, and other times the ones that look relatively normal have a concerning pattern to the pigment and they warrant a biopsy.
And with people, wanting to be outside, it's the summertime, people wanting to be outside. What should be the safest way for them to do that?
Ideally, we avoid the peak hours of the UV index. So between 10 and 2, that's the most harmful UV. If you're going to be out during that time, you want to be really good with putting on a high SPF sunscreen. I recommend 50 or higher. Reapplying every 80 minutes is your goal. If you're in and out of the water and drying off, then you might want to reapply more frequently. And then I like to rely on UPF clothing, material that is impregnated with protective properties, and that way you don't have to put sunscreen everywhere. And then a hat, ideally with a broad brim, and sunglasses that have polarized lenses.
And you mentioned earlier, even if you tan well, you can still have those chances for sunburns and eventually, something that could be a little bit more dangerous. And so, how important do you think it is just for everybody to take all these precautions when going outside?
Skin cancer is the most common cancer. One in 4 Nebraskans will get skin cancer. So it's important for everyone to take these precautions when they're going outside because it is probably the most preventable cancer.
And then just anything else you'd like to add about what Nebraskans can do, or anything else that you have that you'd like to share?
I don't think so, but I do sometimes see people who are reluctant to have a spot looked at, and they know they probably should. And if someone like that is out there listening, this is a good time to have it checked out.
Dr. Bowen, thank you so much for your time and sharing your knowledge with us.
Yeah, thank you.